Welcome to the Dr. Jim Cares podcast with Dr. James Augustine, where we provide powerful solutions for helping you create wellness. Join us as we talk about all things holistic and functional medicine, including, but certainly not limited to, diet, nutrition, and herbs, as well as the latest lab testing and cutting-edge technology to improve and maximize your wellness. Disclaimer: the following discussion is for educational purposes only and is not meant to diagnose or treat disease. Because our approach is individualized, it is important to not apply this information without first consulting with your healthcare professional. And now, here's Dr. Jim.
Today, we're going to talk about something that's absolutely amazing. I've already spoke about this on my YouTube channel, Dr. Jim Cares, but this is a phenomenal test. And I like to say that, maybe you've heard this phrase, if you don't know what you don't know, well, this is a great example. I was at a course a while back, about 3 months ago, and the doctor that was presenting spoke of this particular test, a really cutting edge test that's called the Neural Zoomer Plus. This particular testing, he did this test and he discovered he had all kinds of health problems that he then completely solved. So I was very intrigued by this. Signed up with this lab, ordered the test for myself. And for me, I take good care of myself. I'm doing blood work, really comprehensive blood work. I do stool testing. I do urinalysis. I do all these tests. I have a full body scanning technology called the Menla Scan Pro that I use that shows 128 markers of full body physiology. So I like to call it the full body scan. And my results are always really good. I keep everything in good balance. But I've noticed that my memory has been a bit of an issue lately. And so I was really intrigued. So I did this test. And oh my gosh, mind-blowing results. I was not as good as I thought I was. But imagine a blood test that really demonstrates and shows you antibodies developing in your brain for all sorts of health problems. That's what this test's about. In doing this test, I've discovered that I have more than several problems going on. I have something that's called the anti-RAGE peptide. I have the anti-Purkinje cell issue, which these are antibodies developing in my brain. I have brain inflammation, which is called the anti-dopamine receptor 2. I have infection from Epstein-Barr Virus. Anti-myelin proteolipid protein, so I have demyelination going on, as well as my blood-brain barrier has holes in it. So all of these component parts. Literally, this means that I'm set up to develop Alzheimer's, Parkinson's, multiple sclerosis, and not good. Really not good. So I guess it means that this slight memory loss that I've been noticing, and that's the problem, is we all start to notice these types of problems developing, and you just kind of blame it on, well, I'm getting a little bit older, and my brain's not as sharp as it once was. This testing has been profound and very, very sobering. So within 10 minutes of receiving the results, I was, of course, shocked and surprised, and I had developed an entire protocol to be able to solve these problems. I went over this testing, by the way, with a specialist who is trained by this laboratory to train doctors who are going to be doing this type of testing, because it's very different testing. So you want to be able to interpret it effectively. So I did. And she had mentioned several interesting parts of this. So as I go through this and explain my results to you, because yes, I developed a protocol and there wasn't really much else that I learned from her except just some nuances that were very significant. So the anti-RAGE peptide, what that really means is anti-RAGE is not rage like anger. It means a receptor site for advanced glycation end products. Literally, brain plaquing is beginning to form in my brain, which is associated with Alzheimer's or connected with Alzheimer's. And I've looked, I said, well, I don't do carbohydrates. I'm pretty much on a ketogenic diet. I eat really good fats, adequate proteins every meal, veggies, all of those good things. And why would I have plaquing that's associated with blood sugar issues forming in my brain? Come to find out, and I'm a big proponent of drinking coffee. I was drinking too much coffee. And when you have this perpetually high cortisol level that's just up too high for too long a period of time, that's what was tending to form this plaque. So even though I don't have any problems whatsoever with coffee, organic coffee, and I have other videos out there amongst social media that talk about coffee, has a lot of great things involved in it, but high cortisol levels, drinking too much for too long, can start to cause these problems. So that was the anti-rage peptide. Anti-Purkinje cell, that's where it's Parkinson's and things of that sort. So let me go through the process that I've developed to solve these issues. So as I said, anti-rage is going to be lessening my coffee intake, making sure that my blood sugar stays perfectly balanced, not doing carbohydrates, right? Starch and sugar. I can do some, but nothing to really stimulate or kick up my cortisol, my blood sugar, my insulin. For the anti-Purkinje cell and to then restore brain tissue, it's going to be Neuroplex. This is a standard process vitamin that helps to deal with acute brain symptoms. Neuroplex gives you all the raw materials to get your brain to function normally. But at the same time, I'm doing neurotrophin protomorphogen, neurotrophin PMG, also from Standard Process, the only company that's discovered protomorphogens. What that is, it's a tissue cell determinant, literally made from brain tissue, does four primary things. Helps you to make and create normal, healthy tissue cells of that type of tissue. Number two, it normalizes the function of that tissue. Number three, it gets the tissue to heal. And number four, it shuts down autoimmune responses and inflammation in your brain. Now, this is why it's so significant. Because this is an autoimmune response, my immune system has developed autoantibodies that will attack and destroy brain tissue. And certainly in medical circles, they can give medications that tend to calm down the symptoms of, but never to get rid of the attack on your brain tissue. So what this does is the protomorphogens look just like, in this case, neurotrophin looks just like my brain tissue. And at the same time, my immune system, then the autoantibodies are designed to attack and destroy my brain tissue. Instead, it's sort of a decoy, like a flare that binds up and gets rid of the autoantibodies. And therefore, when I've gotten rid of all the autoantibodies because I've taken neurotrophin now for a period of time, what happens is there's no more autoantibodies to attack and destroy my brain tissue. Good thing. At the same time, I'm doing other things to get the tissue to repair. So also taking Cataplex B Core, a whole food B vitamin, and as many of you know out there, B vitamins are essential for neurologic tissue function. So I'm taking neurotrophin. It has all the B's in it as they occur in food. Phenomenal B vitamin. I'm taking phosphatidylserine, also involved with brain function. I'm taking alpha lipoic acid, which is providing the raw materials to repair brain tissue. Maybe some of you have heard of MCT oil. Stands for medium chain triglycerides. From coconut oil, phenomenal also to help repair, being raw material to repair brain tissue. I'm also taking high potency fish oil. Again, your brain is DHA fish oil type of fat, so that's what I'm taking. I'm taking Bacopa complex. It's an herb that helps mental acuity, focus, concentration, as well as memory. Bacopa complex, phenomenal, also from Standard Process MediHerb. Now for the brain inflammation, I'm taking turmeric forte. You've heard of turmeric. The uniqueness of turmeric forte is that the turmeric is actually bound to not pepper, as most turmeric out there is bound to pepper. This is actually bound to fenugreek. Fenugreek is an herb that can actually transport it past the blood-brain barrier. Most of the other turmerics out there are literally detoxified or pulled right out of your system through your liver, whereas turmeric forte has been tested to over 90% of it actually will remain in your bloodstream to provide anti-inflammatory responses throughout your body, helps to bring down that inflammation. And guess what? It goes past the blood-brain barrier although I have holes in my blood-brain barrier, so I don't have to worry so much about that. But yes, to take down that inflammation in my brain. Furthermore, critical is this Epstein-Barr virus. I had it probably back when I was in my early 20s, Epstein-Barr, and it's one of those stealth pathogens, meaning typically doctors don't test for stealth pathogens, Epstein-Barr being one of them, but I discovered also from this doctor who went over my test is that it's reactivated with COVID. Back in the day, I had COVID. It was about a 3-day cold for me, but it still can reactivate these stealth pathogens. So I'm taking the stealth pathogen protocol. That is artemisinin and myrrh for about 4 days, and then I switch over. I put those aside, and I switch over to something that's called Echinacea premium, as well as Viranon. Echinacea premium, Viranon for about 5 to 6 days. Then I start over, and I go through about 10 to 12 cycles of this process to make sure that we really knock down and normalize and get rid of that Epstein-Barr infection. Blood-brain barrier, the next thing to repair. There I'm using several things. Gotu kola, which is an herb that's phenomenal for repairing any and all connective tissue, including blood vessels and vasculature, connective tissue like tendons, ligaments, those sorts of things. So Gotu kola, as well as another product from Standard Process that's called Saruta Plus or Cyruta Plus. It's a special type of whole food vitamin C complex that helps also to repair connective tissue. We also use this for vasculature repair. It helps to repair that inner skin lining of your blood vessels called endothelium. Well, in this case, repair my blood-brain barrier with these two supplements. Furthermore, what else am I doing to help to repair my brain? Is I'm doing high voltage pulsed electromagnetic fields. Critical. High voltage is completely different than low voltage technology. This particular high voltage technology helps tissue repair like I've never seen before. Literally charges up tissue, helps it to heal up and repair like I've never seen. Absolutely amazing. No side effects or risks to doing that, by the way. Another thing, and this is done by hand by a doctor, it's called Biocranial. We do this in my office. Phenomenal. Jumpstarts and improves brain function. And since the brain is the ultimate doctor and healer inside the body, that's why I want to do this. I need healing and repair for my brain tissue. From a lifestyle perspective, I'm doing the ketogenic diet like I had mentioned earlier. So therefore, why is that such a big thing? Is because the essential fats that are in it. I'm doing olive oil, I'm doing grass-fed butter, eating the fat in meats and things of that sort. Lots of good essential fats, as well as adequate protein and good veggies. So ketogenic diet for that. Here's how this process works. Literally, I've done the testing initially. I'm now working on repairing tissue. 6 months, I'm going to do this for 6 months, and then I'm going to actually retest. Redo this blood work, neural, Zoomer Plus. What I should expect is that I'm going to have a considerable drop in the antibodies and the findings on this test. Then I will continue that process for another 6 months, retest, and everything should come back to normal. So one question that you may be thinking, well, who should be doing this test? I would say everyone who has a risk factor like MMA fighters, mixed martial arts, UFC, that has the potential for head injuries and concussions. Getting hit in the face or the head, getting kicked in the head, not so good. Landing on your head, not a good thing. Also, NFL football players, anybody that has potential for concussions to their head, their skull. Which then goes to, well, the average person who's had a concussion, a car accident, has played sports, has been knocked down. Concussions are the big deal that can start off this process. Also, those people out there that have had symptoms of memory loss should be doing this testing. Brain fog, memory loss, things of that sort where you're going, well, you start to blame it on your age, not a good thing. Get this testing. Now, let me also tell you something really interesting. I have actually many patients with terrible chronic illness, Parkinson's, ALS, Alzheimer's, things of that sort. We've done some other testing. There's another test that we do, and it's a very also cutting edge test. It's called the Alzheimer's Lynx test. And I've had several patients completely normal, and we've done the testing twice with that testing. We've now done this Neural Zoomer Plus test, and guess what? This test really brings up and shows us the tissues that are having problems, and therefore, if we know what tissues are having problems, we can start to support that and get those tissues to heal and resolve. For instance, case in point, patient, she's in her mid to late 70s, has Parkinson's, and she's not the shaking type of Parkinson's, but she's more of the freezing up type of Parkinson's. We did this test. First off, that other test they called the Alzheimer's Lynx test, not much shows up there. This particular testing, it shows up a bunch of things. Therefore, we're working on repairing those tissues, and she's going to actually do really well. What else? Other patients. I have another patient who is probably 67 years old and just been noticing very significant memory loss, as well as his wife's been noticing it. Plus, he's responsible, his job is responsible for lots of people. When you can't remember names and people and things, it's just not a good situation. So also we've done that testing twice on this particular gentleman, did this test, and this test shows up with all of these issues going on. So the right type of testing is also critical. Now, mind you, both these tests are cutting edge technology. This test just is the bomb. It's the thing to do. So if you're having any of these issues, please contact me at draugustine@gmail.com. Call me, 562-860-3404. My practice is in Buena Park, California. I'd love to answer your questions. I'd love to help you out on this. And that's what this podcast is about. This is my first episode number 1, but that's what it's about. I'm also on social media. I'm on YouTube, on Facebook, Instagram, as well as TikTok. My name is Dr. Augustine. I hope this is helpful, and you have a great day.
Thank you for joining us on your journey to wellness. If you'd like to meet with Dr. Jim in person or on Zoom, you can find him at his office, Ahead to Wellness, in Buena Park, California. Give him a call at 562-860-3404 or email Dr. Jim at draugustine@gmail.com. That's DRAUGUSTINE@gmail.com.